So anyway, we will go ahead and get started with the webinar in a moment, and you'll see in the chat area to please dial 1-949-202-4265. And so now, please see our website for more information on all of our offerings, including our Blog Talk radio shows with Heather Butts, our webinars, and webinar recordings. And now, the Mind Body Medicine Network presents Chronic Pain and Associated Symptoms, Healing the Mind in Order to Heal the Body with Howard Schubiner, MD. And I'd like to give you a little bit of Howard's background. So Dr. Howard Schubiner is board certified in pediatrics, adolescent medicine, and internal medicine. He was a full professor at Wayne State University for 18 years and now works at Providence Hospital in Southfield, Michigan. He is a fellow in the American College of Physicians, the American Academy of Pediatrics, and the Society for Adolescent Medicine. Dr. Schubiner is known as a national expert in ADHD in adolescents and adults, as well as mindfulness meditation and stress reduction. He has authored over 60 publications in scientific journals and books and performed research in the fields of adolescent health, ADHD, and stress reduction. Dr. Schubiner is on the editorial boards of the Journal for Adolescent Health and the Journal of Attention Disorders. He has given over 250 lectures to scientific audiences regularly, regionally, nationally, and internationally on topics related to adolescent medicine, ADHD, and stress reduction. Dr. Schubiner has consulted for the American Medical Association, the National Institute on Drug Abuse, and the National Institute on Mental Health. He has been granted funds to conduct research studies of over $7 million in total. Dr. Schubiner teaches a form of meditation known as mindfulness meditation, which helps individuals cope with the stressors and anxieties of daily life. Dr. Schubiner is the founder and director of the Mind Body Medicine program at Providence Hospital. This program uses the most current research methodologies to treat individuals who suffer from MBS or TMS, as described by Dr. John Sarno. Dr. Schubiner has created a program that uses both meditative and cutting-edge psychological techniques to help individuals with chronic conditions such as fibromyalgia, whiplash, back and neck pain, myofascial pain, TMJ syndrome, tension and migraine headaches, irritable bowel syndrome, irritable bladder syndrome, insomnia, anxiety, and other related conditions. He is currently performing the first randomized controlled research study in the field of mind-body syndrome, or TMS, for individuals diagnosed with fibromyalgia. Finally, he was included multiple years on the list of the best doctors in America. Dr. Schubiner lives in the Detroit area with his wife of 25 years and has 2 children in their early 20s. And I am so excited to now share Dr. Schubiner with you. I have benefited greatly as a clinician. The patients that I treat, the groups that I've run with the Unlearn Your Pain program have gained so much from Dr. Schubiner's approach, and I'm sure you will this evening. So welcome, Dr. Schubiner.
Wow, thanks, Ed. That's really kind. I really appreciate being here. It's nice to talk to everybody from the privacy of my home. I don't usually get to give lectures from my house, wearing pajamas and drinking beer. No, I'm not really doing that. But I'm excited to speak with you guys. And I want to start by saying three things before we kind of get into the formal part of the presentation. 3 things that I just know are true. The first thing is it's really important I think, for people to understand how powerful the mind is. The mind is extremely powerful. It can produce symptoms of any kind. It can produce paralysis. So I've seen people, and most doctors have seen people who've had paralysis of an arm or both legs due to the mind, psychological factors, not a disease in the body. Paralysis, any symptom can be produced by a disease in the body, of course, but the mind is so powerful. It can produce pain that is so severe that it is overwhelming. And most doctors really don't understand that. And I think most people don't really understand that. And I've been a doctor for 30 years, and I know I didn't understand that truly until I started doing this work, the mind-body medicine work over the past 9 or 10 years now. So the mind is extremely powerful. And the kind of symptoms that it can produce can be so severe, and Ed listed some of the disorders that I typically treat and see in my patients. If someone goes to a doctor, to the emergency room, or visits, primary care doctors or specialists, and they have severe symptoms, and the symptoms aren't diagnosed as a medical problem within a relatively short amount of time, usually it would take a few days, a week, or a couple weeks, really. If the symptoms aren't diagnosed, it's highly likely that those severe symptoms are produced by a mind-body type problem, by the mind. So the mind is very powerful. That's the first thing that is really important to understand. The second thing is that emotions and emotional reactions are the primary drivers for how we live our lives. And again, this is something we weren't taught in medical school. Most people don't realize, but when you look at the literature and you look at the science behind the mind and behind what causes us to make decisions in our life, it is emotions. And emotions are the primary cause of symptoms that occur when there is no clear medical, physical, structural explanation for them. And that's the second thing. And the third thing is if you understand numbers 1 and number 2, that the mind is powerful, that emotions can cause reactions in our bodies that are severe, then the third thing that's true is if you look, you will find it. If you know what you're looking for, you will find the answer to the problems that you're having and that your clients or patients are having if they're not easily diagnosed as a medical structural problem. And at the end, we'll have time for questions, and if any of you have questions about and I'll talk more about this through the course of the talk. If you have questions about what would produce or what kind of symptoms are more likely to be medical or mind-body, we can talk more about that. So the mind is very powerful. It can produce any symptom. Severe symptoms that are not easily identifiable as medical problems are almost always mind-body problems. Emotions are the driver for these symptoms. And if you look into our lives, into the lives of yourself or your clients or patients, and you know what you're looking for, you will find what you need to know. You will find the answer. You will find the reason for those symptoms. So, for example, I saw a lady with severe headaches for 17 years. 17 years, daily severe headaches. She had been to over 20 doctors. She had been on over 20 medications. No one could help her. Severe symptoms, and all the testing was negative for any severe medical problems. So what do we look for? We look for the emotional reactions in her life that might have caused this. And the pain started after she got a new pair of glasses. When she put those glasses on, she started getting head pain. Now, a new pair of glasses doesn't cause pain for 17 years from a medical point of view. But the glasses were a triggering event. And what was going on, and her story was that as a child, she had been sensitized, emotionally sensitized by an aloof and not caring mother and by a very emotionally abusive father who used to yell and scream at her all the time. And she grew up and, lived her life. And then when she was about 35 years old, she got a new pair of glasses one day, and it triggered this severe head pain. It lasted for 17 years. And so the triggering, the primary emotional events in her life was aloof mother and emotionally abusive father. The triggering event was the glasses, but it wasn't just the glasses. The glasses occurred at a time in her life when she had a new boss, and her boss was emotionally abusive, yelling and screaming at her. So the triggering event was the situation at work, and the head pain was a reaction that her body had created, her mind had created, to alert her to the problem in her life, to a danger in her life. And that's the way our minds work, that's the way our bodies work. And and now this lady's fine. After 17 years of pain, she's fine. The headaches are gone, because if you know what you're looking for, you can find it. And she, through seeing me and understanding this process and going through a program to help her deal with the issues in her life and understand why she had pain, now she's fine. So if we could go to the slides, Ed. So this is a simple yet revolutionary concept. Stress and unresolved emotions create real physical pain and many other symptoms, as Ed pointed out, by triggering something that I call nerve pathways. We're going to talk more about that. When there's no disease process in the body, they're not. Disease process is defined as a pathologic change, like a tumor, fractures or tissue damage changes, pathologic changes in the body. Physiologic changes in the body are what mind-body syndrome or mind-body problems are caused by. In other words, when the heart is beating fast because you're exercising, that's a physiologic process. When the muscles tense up because of emotions, that causes pain, but that's a physiologic process. It's created by the mind, and it can be reversed by the mind by dealing with the issues in our lives. Next slide. So a nerve pathway, I need to explain, is simply thousands of nerve cells in the brain which cause changes in our body. So when you learn how to ride a bicycle, you learn, your nervous system learns that whole process of balancing and pedaling and all that stuff that goes into riding a bike. And once you learn it, then it's there. It can come out at any time. 10 years later, you get on a bike. You ride a bike. It's a nerve pathway that's been learned. How we walk, how we sign our name, how we talk, the gestures that we use. All these are nerve pathways. If I say, what's 5 times 5? And you say 25, that's a nerve pathway that's been learned. So there's thousands of these nerve pathways that that cause us to do what we do every day of our lives. And so it's not only physical things that are nerve pathways, but also emotional things. Everyone understands, if you get bit by a vicious dog, you will learn fear of dogs. And then when you see barking dogs later in life, chances are you may tense up. So that's an emotional pathway that's been learned. And the thing that I've learned in the past 10 years is that pain can be a nerve pathway. When there's no physical pathologic tissue damage problem causing the pain, it's almost always a mind-body problem or a what I call a nerve pathway problem. And these things are very real. They can cause incredible symptoms. And most doctors do not know that. There are very few doctors who understand that nerve pathways can cause as severe pain, as real pain, as kidney stones, as childbirth, as anything that you can imagine. Next. Next slide. So here's an example. I tried to show an example on the right of what a neural pathway or a nerve pathway looks like. These are connections of brain cells that act in the body, and there's that red on the left. There's that red cell, which is a neuron, a nerve cell, and then you see all the little faces in there. That was a slide that I found where you can imagine that those are the emotions that are. We don't really have those little faces there in our brain, as far as I know. Next slide. So the horrible part is that we have more and more chronic pain. 100 million people roughly are estimated to have had chronic pain in this country, in the United States. Worldwide, it's obviously many, many more. It's estimated that $500 billion are spent on chronic pain every year in this country. And the vast majority of people with chronic pain do not have a structural tissue damage cause for their pain. And this is a total revolutionary idea. It's total newsflash for physicians, doctors who work in chronic pain. They presume that there's some damage in the body that's causing the pain. And the vast majority of the time, that is simply not true. And when the doctors and patients assume that there's some structural tissue damage problem causing the pain, then obviously the answer would be more medication or more injections or surgery. But those things haven't been shown to be effective. And mind-body treatment has been shown to be effective for people with chronic pain, even severe pain that has lasted for many years. Next slide. And it's really important for us and for clinicians, mental health providers, physicians, and patients to understand that we know that everyone should know that this pain is very real. It is can be extremely severe, and it can be totally overwhelming in terms of people's lives. I have so many patients that I see where they say, my whole life seems lost. I've turned into a professional pain patient. And for people to work as clinicians, to work with patients with chronic pain or patients who have chronic pain, it is very important to understand that empathy, love, and caring and kindness to them and understanding them, and patients who have pain for understanding themselves and being kind to themselves and not blaming themselves. It's not their fault that they have this pain. And understanding that at the end of the day, the thing that's going to cure their pain is kindness to themselves. And we'll be coming back to this toward the end of the talk. Next slide. So in terms of the idea that all pain is real, fibromyalgia disorder, where there's been a lot of controversy about. On one hand, some doctors are saying, well, it's not real, that's fake, it's not real pain, or that's ridiculous. The pain is very real, and this is a functional MRI study done at the University of Michigan showing that the pain of fibromyalgia is very real. We know that it's real. The problem with fibromyalgia is that, on the other hand, doctors, now we've realized that the pain is real, but the biotechnological type doctors, they now say, well, the pain is in the brain. Yeah, we get that. We know there's no disease in the body with fibromyalgia, but they say it's a disease in the brain, so therefore the treatment is medication. And the studies show that medications have very minimal or marginal effect in patients with fibromyalgia, and so people feel doomed. They know they have a real disease, but they feel doomed because they have no out. They have no way of dealing with it. But the mind-body approach is effective, and I'll show you data on that a little bit later. Next slide. So, again, to reiterate the point is that not all diseases are caused by the mind. Cancer is not caused by the mind, and I don't tell people with cancer that I can help them cure their cancer by thinking about it differently. But on the bottom part of that slide, PPD, or psycho-physiologic disorder, which is another name for a mind-body syndrome, psycho-physiologic disorder, is caused by the mind. And the disorders that Ed mentioned at the top of the webinar, irritable bowel syndrome, interstitial cystitis, or painful bladder syndrome, anxiety, depression, insomnia are psycho-physiologic disorders. Fibromyalgia is. Migraine and tension headaches is. Most people, not all, but most people with back and neck pain have a psycho-physiologic disorder, a PPD. Those are caused by the mind. Those can be cured by the mind, and that's a fact, and that is so revolutionary for our day. Now there's a certain number of disorders that are in the middle. Asthma, IBD, which is Crohn's disease, or ulcerative colitis, MS, multiple sclerosis, are disorders that do have pathologic processes. There is tissue damage in those disorders, but research has shown that the mind can influence them. So those are disorders that I would consider to be somewhat in the middle. Next slide. So let's talk about back pain for a little bit. Back pain and neck pain. It's epidemic in our society, but it's something that for the vast majority of patients can be helped, can be reversed if they have a careful workup and if they've had good mind-body treatment. MRIs are tests that we do on most patients with back pain nowadays, and what happens is you get an MRI and the doctor says, oh, you've got bulging discs, you've got degenerative discs, you've got spinal stenosis, you've got spondylolisthesis, you've got facet arthropathy, you've got osteoarthritis, and all these things are normal for age. Now, if someone on an MRI has a tumor, has an abscess, has an infection, those are not normal for age. Those are the cause of severe symptoms that require surgery. Or if there's a fracture, that's the cause of the symptom. But the research shows that people who have no back pain, when you do MRIs on them, most of the time the MRI is abnormal. There's bulging discs and lots of other things that I mentioned. And several studies have shown this, not only one. The problem then comes is that if you have an MRI that's abnormal with mild abnormalities, the doctor doesn't say, oh, well, that's normal for age. They say, oh, that's what's causing your pain. I saw an airline pilot from another state came to visit me. He had an MRI that showed he had severe back pain. He could hardly work as a pilot. His job was, on the line. And he had a 1 millimeter disc bulge in one area, and the doctors told him that was the cause of his pain. And that was just not true. And it was heartbreaking for me to see this guy getting all bent out of shape and worked up and scared to death because the doctors had told him that there was a disease in his back when his MRI was just normal for age. Next slide. Research from Stanford, for example, shows that when you take a group of people, an employee health situation, and you give them MRIs, and then you follow them 5 years later with a repeat MRI, and then you look at also their psychological variables at the start, and then 5 years later, the MRIs did not show any relationship with those people who developed back pain. The psychological variables, the things in their lives that were problematic for them, were related to the likelihood of them developing back pain. This is a very difficult concept for a lot of people to grasp and a lot of doctors to grasp. Next slide. In a recent study just done this year from Norway, they took people in a workplace setting and they followed who developed back pain and who didn't. And they looked at how much they use their arms, how much they use their shoulders, how severe how much physical work did they have to do on the job. And 2 years later, the people who did more or less physical work, that was not correlated with who developed back pain. What was correlated with who developed back pain was how they were treated in the workplace, who controlled the decisions, what kind of bosses they had, what kind of leadership they had. Did they think they were getting a fair shake in their job? Those were the things that were more likely to be connected to those people who had back pain. And so this is the truth about back pain that very few doctors have any inkling of. Next slide. And we're spending a tremendous amount of money. As I said, we're doing lots and lots more tests and more treatment for back pain. But what's happening over time, instead of more treatment leading to less pain and less disability, more treatment is associated with more pain and more disability. And it is very sad, as I mentioned with that airline pilot, when people come to a doctor with back pain, they're worried about what might be the problem, and the doctor says, "Oh, you've got a bulging disc." So now they've turned into a back patient, someone who has a disease, and the treatment is often not likely to work because if we're looking in the wrong place, we're going to get the wrong treatment. Giving injections, doing medication for back pain that is caused by the mind, not really the right thing to do. It's not going to help. So people often get worse over time because they're more afraid, they're more scared, they're more frustrated, they're angry because their treatment isn't working. And then they may need to leave work or take time off of work and then have financial problems. They may get isolated socially, and there's this tremendous spiral of the chronic pain patient. And I'm sure some of you are unfortunately all too well aware of that. Next slide. Is back surgery a really good idea for people with back pain? It turns out in several, 6 or 7 research studies now, when you look carefully at the data, comparing back surgery for people with back pain versus not having back surgery, there's no difference in the outcome. Surgery has not been shown to be helpful for people with back pain. If you're in an HMO like Kaiser in California or the West Coast, and you have back pain and your doctor says, I think you need surgery, Kaiser says, no, you don't. There's no evidence that it actually works, but we're spending billions of dollars on surgery for common back pain. Now, some people need surgery for back pain, as I pointed out, if there's an abscess or an infection or a severe alteration of the nervous function. But for the vast majority of people, their exam is perfectly normal. There's no evidence that there's a serious disease process going on. Next slide. Here's a study from Ohio where they compared people who had back surgery to those who didn't have back surgery, who were on workman's compensation files. And the reoperation rate for back surgery, 27%. Reoperation, complication rate, 36%. Days off work, much more in people with surgery than people without surgery. People who had surgery, 26% of them returned to work, whereas people who did not have surgery, 67% returned to work. It is a huge difference in a very scary research study. Next slide. This is a MRI of a lady that I saw. She had 9 years of severe back pain. She was on disability. She was scheduled for surgery because of back pain and this MRI. She did have back pain, and her back pain was severe, but she had no pain in her legs. She had no evidence of abnormalities in her legs. Her neurologic exam was perfectly normal. There was no evidence that the spinal nerves were being compressed. But yet, if you look at this results of this MRI, it looks pretty bad. There's disc space narrowing. There's disc disease. There's disc bulging. It shows set hypertrophy, which is osteoarthritis. It shows nerve root compression. And it shows all that. But again, we have to understand and that the research shows that most people who are in their middle age or older have abnormalities on an MRI. It's normal for age. She came into my program, and instead of having surgery, 3 weeks later, her pain was gone. 0 pain. And I showed this to the surgeon, showed her case to the surgeon who was going to operate on her, and he just kind of shrugged his shoulders. Oh, gee, okay. He wasn't really all that interested in, well, what did you do? How did you get her better? Wasn't all that interested, just went on his way. About 6 months later, she had a recurrence of pain. She had back pain in the same area. And she called me up. She said, oh, I had more back pain. I said, oh, what happened? She said, well, I figured it out because I knew what I was looking for. I didn't injure myself. I hadn't damaged myself in any way. I just started getting back pain one morning. But that was about an hour after I got a letter. We got a letter at our house from the government that my daughter, who's in the military system in the Army, was being shipped out to Afghanistan. And I knew that was the cause of my recurrence of pain. And she said, I knew what to do, and I could make it go away within a few hours. Amazing. Next slide. So whiplash is a disorder that in North America we know is a serious problem. It causes tremendous amounts of disability. There was a researcher in Norway, and whiplash is a injury to the neck, a strain of the neck, and for some reason it can last for years or decades with pain, cause disability, cause people not to be able to work. And this was true in Norway. There was a researcher up there, Dr. Schrader, who had, there's 40,000 people on disability for whiplash in Norway. Tremendous number for a small country. And so he decided to go to Lithuania to see, well, is there whiplash there? Because anyway, I'll tell you why in a minute. Next slide. And so when he went to Lithuania and he studied people before and after a car accident, it turned out there was no whiplash in Lithuania. It didn't matter if they had a headrest or seatbelt or how much the car was damaged, the speed of the impact. None of that mattered in terms of if people in Lithuania developed the syndrome that we call whiplash, of chronic pain, neck pain, and chronic headaches. He was criticized for this study because it was a retrospective study. So next slide, he went back to Lithuania a few years later and he studied prospectively. And guess what? There's still no whiplash in Lithuania. And, people were kind of shocked. There's an article in a Canadian medical journal that says, "Cure for whiplash, one ticket to Lithuania, please." Because what's going on? In Norway, if you get in a car accident and you go to the emergency room, they tell you, oh, you might get whiplash. You better rest. You better wear a collar. You better take some leave, take some days off of work. And it creates fear. Pain that creates fear tends to create more pain. And in Lithuania, if you get in a car accident and you go to the hospital, what do they tell you to do? They say, well, go back to work. You'll be fine. We don't have whiplash in this country. It's not part of their culture. Next slide. And it again shows how powerful the mind can be. In Greece, there's no whiplash. Many countries like that. Next slide. And they compared the expectations between Germans and Canadians. In Canada, there's high degrees of whiplash, not so much in Germany. And so in Canada, the Canadians said, well, if they were asked if you get in a car accident, what's the likelihood you may have chronic headache, chronic neck pain? And then 32 to 50% of Canadians said, well, yeah, you might have whiplash for years. And the Germans said, no, it's pretty unlikely that you would have whiplash for years, very unlikely. You would have pain for years. And could that expectation be powerful enough to create a severe and disabling syndrome? The answer is yes. The mind is unbelievably powerful. Next slide. And so the medical students that I see, they're pretty smart. They say, Dr. Schubiner, well, come on, this is pretty obvious. It's the people who have the severe neck injuries like fractures and dislocations. They're most likely to get chronic neck pain, where the people with the mild injuries like a strain or a sprain, they're not going to have chronic neck pain. And it turns out it's the opposite. It's the exact opposite. People who have severe injuries are less likely to have chronic neck pain. It's the people with the mild injuries who are more likely to have chronic neck pain. Why? Because it's not the injury that's causing the pain. The injury heals. The body heals. If you have an injury, your body will heal. And scars do not cause pain. So how could this be? Next slide. Here's a study that explains this, I think, really well. It's a placebo car accident study. It's a simulated car accident. They put people into a car and they felt like they were having an accident, but there was no movement of their neck. There was no jarring of the neck at all. And it turns out 4 weeks later, a month later, 10% of the people in the study had neck pain from an accident that never happened. But who was getting the neck pain? It was the people who were most stressed and emotionally distressed at the time of their life when the accident occurs. And so when you think about, remember the lady I talked to you about with the headaches, getting a new pair of glasses, a new prescription, triggered her headache. And a car accident is a very easy and common trigger. A physical injury is an easy trigger, common trigger for people to develop a nerve pathway type pain or a nerve pathway type problem. It's not the cause, it's the trigger of it. It's an opportunity, in a sense, for the brain to tell us, wait, stop, be alert, be careful, there's something going on in your life, and you need to know about it. The body talks to us, and it doesn't talk in English. It speaks in symptoms such as pain. Next slide. So do car accidents cause neck pain? Well, here's a study of demolition derby drivers. These are drivers who have hundreds of car accidents. They do not get chronic neck pain. They may get acute pain because they might have an injury to their neck. And of course, you can get injuries to your neck with car accidents, no question about it. The question is, what happens after that? The injury will heal. And for these people, demolition derby is fun. They love demolition derby. That demolition derby and car accidents in them do not cause chronic neck pain. Next slide. So, is it our culture? We know that the mind is strong. Voodoo can kill people. Voodoo can cause severe pain. When someone in Haiti sticks a needle in a doll, the expectation is that this could be a problem, and the mind can create symptoms in the person who's represented by that doll. Every society in the world over has culture-bound syndromes, syndromes where the mind can cause these types of severe symptoms and all sorts of symptoms. And in our society, it's whiplash, it's most back pain, it's fibromyalgia, it's irritable bowel syndrome. Those are our culture-bound syndromes. Those are the ways that we respond when we're in stress and when we have emotional reactions to things in our life. Next slide. So I'm not sure I need an emergency room. Is there a reassurance room? People going to the emergency room need to be reassured that they're okay. When that's the case, they don't need to be frightened, which can make things worse. Next slide. So I mentioned that fibromyalgia is a mind-body type problem. It's a nerve pathway problem. There's no tissue damage in the body. This is a fact. All researchers on fibromyalgia agree about that. It's a central pain amplification problem, or a central nervous system sensitivity problem. A variety of names are given to that. And like I say, if you look, you'll find out why. If you know what to look for in terms of the emotional reactions in people's lives, you will find the cause, what triggered the fibromyalgia in almost every single patient. But there's a way of diagnosing this central pain sensitivity or amplification. It's by thumbnail pressure. And people who have are very sensitive to thumbnail pressure, people with fibromyalgia have that. But it turns out people with back pain also have sensitivity to thumbnail pressure, which shows that people with back pain and fibromyalgia, it's not just in the body. Next slide. So one of the things we know about pain is that the brain can create pain. This is a study from University of Pittsburgh where they show that hypnotically induced pain causes the exact type of pain, the same changes in the brain as physically induced pain. Next slide. Next slide. I'm going to skip over this. And so there's this whole variety of syndromes, as I'd mentioned at the start: myofascial pain syndrome, TMJ, temporomandibular joint syndrome, migraine headaches, tension headaches, irritable bowel, chronic fatigue syndrome, fibromyalgia, irritable bladder syndrome, anxiety, depression, back pain, neck pain, and PTSD. PTSD, well, how's that central sensitization? Well, think about it. PTSD is someone who's been through a traumatic event that then they have learned responses of flashbacks, fear, anxiety, nightmares. And fibromyalgia and these other mind-body problems are every bit as real. They're a traumatic event which has led to the learned responses in the brain and in the body of pain and fatigue and cognitive dysfunction and the whole range of symptoms. And it turns out people with PTSD have high levels of pain, and people with chronic pain have high levels of PTSD. They're really all part and parcel of the same underlying phenomenon. And it is so sad to see our veterans coming back from foreign wars with these huge rates of PTSD, and we don't have good answers for them. Medication has not been shown to be effective as a cure. It may help to some degree with people with severe PTSD, but you've got to get to the underlying emotions that are causing it, and that's what we do in this program. Next slide. So parts of the brain can activate pain. There's a circle on the slide, the cingulate cortex, and that part of the brain, the ACC, anterior cingulate cortex, activates pain. Next slide. And when people with chronic pain are taught to either activate the ACC or deactivate it. When they activate it, pain goes up. When they deactivate it, pain goes down. We can control pain by changing the brain. Next slide. The opposite part of the brain is the dorsolateral prefrontal cortex. It dampens pain. When this is activated, pain goes down. Next slide. This is a study of people who are cutters, people who cut themselves. It's an unfortunate situation but they have very high pain threshold. Next slide. And when you scan their brains, their dorsolateral prefrontal cortex, the part that's little lighting up on that brain there, is activated. That shows how powerful the dorsolateral prefrontal cortex is in dampening and stopping pain. What I tell my patients is we're going to help you activate the dorsolateral prefrontal cortex, and that's going to stop your pain. Next slide. People who are given a placebo pill who have irritable bowel syndrome get better or they don't. In the bottom left, those who get better, you can see the dorsolateral prefrontal cortex lighting up. And on the top left, people who don't get better have the anterior cingulate cortex lighting up. And these are in relationship where if one goes up, the other one goes down, an inverse relationship. And so the brain can change irritable bowel syndrome and chronic pain. Next slide. And emotions activate the ACC. So social exclusion in this laboratory study activates the cingulate cortex and the pain pathways. People who have social exclusion, their pain threshold is lowered. And so it's a direct relationship between emotions and pain. Next slide. And this is a study from Ann Arbor, University of Michigan, Dr. Cross, friend of mine, and he showed that physical pain, where he gave patients, volunteers physical pain in their arm, created certain activation of certain pain centers in the brain, like the insula and the anterior cingulate cortex. And then when you give someone an emotional trauma, showing them a picture of an ex-lover, a boyfriend or girlfriend who had dumped them, an emotional trauma, the same parts of the brain light up. Physical pain causes emotional pain. Emotional pain causes physical pain. And this is the key to understanding chronic pain for the vast majority of patients. Next slide. And so we talked about primary events and triggering events. The lady, remember with the headaches, she had her primary events in her life. The sensitizing events was a non-supporting mother and an emotionally abusive father. The triggering event was a boss who was yelling at her and getting a new pair of glasses. When you do research, when you study people who have fibromyalgia, they have very high rates of childhood victimization, emotional abuse, physical abuse, and or sexual abuse. And I see this every day in my patients. These are the most common primary events, sensitizing events in people's lives. Next slide. And it's the same with people with migraine headaches, interstitial cystitis or painful bladder, pelvic pain, irritable bowel. The same situations occur. Most of those people, not all, most of those people have sensitizing events in their childhood. There are some people who have had normal and wonderful childhoods who end up with these syndromes. They're not that common, but they certainly do exist, and I see folks like that at times. And usually what happens in them is that they were trained to they were brought up to expect a normal, everyone is going to be happy, healthy, caring, good to them, kind to them. There was a woman I saw with severe back pain for three years of severe back pain. She grew up in an idyllic rural environment in another state. And her family was just great and loving and kind and caring. And when her mom was getting older and was sick and ailing, her mom said to her, "I want you to be the executor of the will." And she said, "Yeah, but I've got two older brothers." He said, No, I trust you. I want you to be the executor. And the mom left the family home, the family farm, to her and not to the older brothers. And that created a horrible rift in her family. Her brothers wouldn't talk to her. Her brothers were suing her. And it created a tremendous strain. She was just trying to be good and do what her mom wanted, and she ended up with severe back pain as a consequence of the emotional reactions from the situation in her family. And she's fine now. She got rid of her pain, and she's doing well, I'm glad to say. Next slide. Next slide. There are changes in the brain in people who've had difficult lives, and these changes are real, and these changes cause high rates of cortisol reactivity, stress reaction reactivity, and that's part and parcel of the problem with chronic pain. These are reversible; they're not fixed, and so people who have learned. Next slide. The brain is neuroplastic, and the brain changes no matter what happens. So when we're stressed, the brain changes. When we're unstressed, the brain changes again. Research has shown that. Here's a slide with depression, and depression and anxiety are also mind-body syndromes. They work exactly the same way as chronic pain. If you look on the lower left, you see the little yellow arrows up. These are sensitizing events in someone's life, stressful events in their life. But these are not causing depressive episodes. But then, when they get to middle life, you see the 4 arrows in the middle of the slide going up. Those are more stressful events. And now each of them is triggering depression or pain episodes or anxiety episodes. And then over time, you can see that even when the stressors have gone away or not occurring at the time, the red dots, the depressive episodes or pain episodes or anxiety episodes will continue because now those syndromes have been learned. Those pathways of pain or depression or anxiety or insomnia or fatigue have been learned, and then they just keep going. And they get worse over time frequently because the treatment is ineffective. They are still reversible. Next slide. And so how do thoughts affect pain? Here's an example of a study where they gave people a placebo pill. They told them it was a pain pill. It was really a placebo. And they gave them higher and higher doses of pain by a little shock treatment, not severe, of course. And they told them, half of them, they said this pill cost about 10 cents. And the other half, they told this pill cost about $2.50. And it turned out, amazingly, that the people with the 10-cent pill had more pain. The $2.50 pill caused less pain. Thoughts can affect pain. Next slide. Emotions can affect pain. Here's a study from Chicago where they had people with low back pain, and they had them recall a time when they were angry about something, and they documented that their muscles in their back tightened up, and that caused more pain. The brain can cause the muscles to react and pain to occur. When we change the brain, the muscles lighten up, loosen up, and the pain goes away. Next slide. And it's not only emotions that cause pain, like anger and anxiety, but it's also holding in those emotions. And here's a study where they got people anxious or angry, college student volunteers, and they asked some of them to hold in the emotion, don't show it. And those people had the highest changes in their pain threshold. So holding in emotions is really important in terms of the emotional reactions that cause pain and other mind-body symptoms. Next slide. Oh, wow, this slide didn't come through very well. It doesn't matter. It's a bunch of numbers. But the point is, it's a reminder for me to explain this study to you, which showed that people who have acute back pain, they have an injury to their back, they wanted to see who would be most likely to develop, next slide, who would be most likely to develop chronic pain. And what they found was the people who they scanned their brains, and the people who had more emotional content, who had more activity of the nuclear accumbens and the prefrontal cortex, parts of the brain that are connected to powerful emotions, those were the ones who were most likely to develop chronic pain as opposed to heal their pain. This is a very important study that shows the relationship between emotional reactivity and the development of chronic pain in someone who has a mild back injury. Next slide. So what can we do? There's a whole variety of things that we can do. Amygdala is part of the fear response mechanism, as many of you probably know, and it turns out that if we, instead of just holding the anger and holding the fear in, if we say, I'm angry, or I'm upset, or I'm worried, that in itself is part of changing the brain and changing the amygdala activity. Next slide. People who sit in a posture where they're closed up and contracted get high levels of cortisol, the stress hormone, and low levels of testosterone, the power hormone. And people who stand in powerful positions and they put their arms out and they say, I'm strong and I'm powerful, and they put their hands up, those people get lower cortisol levels, less stress, and they get more testosterone levels, and they have more self-esteem, and their pain goes down. Pain responses are connected to how we treat ourselves and how we react to our lives. And so there's a lot of simple things that make a huge difference in how the mind can control pain. Next slide. Subconscious mind is what controls this. Next slide. It is not conscious. It's not conscious mind that's causing these. Next slide. It's not conscious mind that's causing these reactions. It's the subconscious part of the mind. Next slide. And so, next slide. I want to make sure I have time for questions. The subconscious mind chooses symptoms for us to have. I had a lady who got pain in her buttock, and I asked her, when did it start? And she said, about the time my husband retired. Her husband was a pain in her butt, and her body was just telling her that. It is symbolic. People sometimes get sick to their stomach when there's something that makes them sick in their lives. They may get foot pain when there's something they can't stand. So the body often produces symbolic symptoms. Symptoms can be contagious. Mind-body symptoms can pass from one person to the next. You read about something, and then you can get it. Injuries that occur, a physical injury can produce pain because of the tissue damage. But once that pain occurs, a pain pathway develops that can be remembered. I saw a woman who had back pain after she fell off a horse when she was 14 years old. And then 12 years later, the back pain went away after a couple of weeks because it healed. But 12 years later, the day before her wedding, when her fiancé came to her and said, sorry, I'm out of here, I'm not going through with it, that's when the pain pathway recurred and her back pain started once again. Symptoms that run in families. Well, my mother got headaches, or my father had irritable bowel, so they think it's genetic, and that's often a good way for the mind to create symptoms. And oftentimes, if someone's doing a lot of typing, they may get wrist pain because the mind will use that as a way of producing a symptom to alert them to some problem in their life. Next slide. And who are the people who tend to get this? The people who are most likely to have mind-body symptoms are the people who are the good people of the world, the kind people, the people who care, who try hard. They're the people who internalize their emotions as opposed to the people who are selfish and self-centered. And those selfish, self-centered people externalize their emotions. They kick the dog. They're more likely to get drug problems or gambling problems or porn problems or anger problems. But the good people of the world who try hard, who are responsible and caring and care what other people think about them and tend to be self-sacrificing and tend to be self-critical, they are more likely to get this because they tend to internalize those emotions and they tend to hold them in. And who are these people? The people who do this are the people who are more likely to have had difficult childhoods, more likely to have had emotional, physical, or sexual abuse, and they're more likely to be women. And that's been shown in many studies. Next slide. This is a research study we did with fibromyalgia. Next slide. We compared people who, we took a group of people and we randomized them, next slide, to a group of people who got the 4-week intervention that I run through my program called Unlearn Your Pain. And the results were that the people in the intervention group got better and stayed better. Next slide. Next slide. About a quarter of the people had at least a 50% reduction in pain, which is a huge reduction in pain for people with fibromyalgia. This is a control group. People started with pain and they ended with pain. Next slide. This is the intervention group, and you can see there's a lot of people at time point 3 down at the bottom with only level 1 or level 2 pain, which is extremely amazing. Look at the lady in the green. At the very start, she had pain, levels of pain as 10, worst pain of anybody. And then at time point 2, she had a level pain of 1. She was basically cured. She had virtually no pain. But then up at time point 3, which is 6 months later, she had the most pain again. But she knew what it was. She said, oh, my husband's going through a difficult time. He's getting a liver transplant. I'm scared out of my mind. My pain is back, but I know what it is. It's my mind. I'm going to control it. And he got better, and she got better. Next slide. This is research, another set of data from our research, from our program. People coming into the program with the average duration of pain almost 9 years. 67% of them have at least a 30% improvement in pain at 6 months after a 1 month program, and 53% have more than a 50% improvement in pain at 6 months. This is only a one month program. And when you look at the results of people in pain clinics, the research shows their pain tends to go up over time, not down. Next slide. We're now doing an NIH-funded $3 million research study on fibromyalgia, which I hopefully will be able to report on in a year or two. Next slide. And what happens is, I said, the brain changes. When people with back pain get better, their brain changes. The dorsolateral prefrontal cortex thickness increases. We can train people to do that to their brains to stop their pain. Next slide. Mindfulness causes changes in the brain and changes in the amygdala activity. We can train people to stop the fear cycle, the fear cycle. Next slide. This is a lady who came in my program, and she was wearing this T-shirt one day, and that's what I ask my patients to do. They need to change how they think about the pain. They need to change how they understand it, and they need to change the idea of who's in control of it and who is the hero of the story. Most people that I see have been so beaten down by pain that they're depressed and they're angry and frustrated that nothing has worked. And they're looking for doctors to help. They're looking for the doctor to be the hero, to find some magic bullet which is going to stop them, whether it's an alternative doctor or a medical doctor. But the bottom line is they are the hero. They are the ones who can change this. Once they realize that, then things can change very quickly. Next slide. So there's a tremendous amount of pain syndromes that can occur, from the head, from the top of the head to the bottom of the foot. You name the area of the body, and the mind can produce pain there. And again, as I mentioned, once medical testing has ruled out a severe medical problem, a serious medical problem, then the diagnosis is clearly a mind-body problem. The problem with medicine is that it tends to tell us that mild problems are the cause of severe symptoms, and that is simply not true in the vast majority of the cases. Next slide. Irritable bowel, irritable bladder, postural orthostatic hypotension. There's a tremendous number of these syndromes. Reflex sympathetic dystrophy is now called chronic regional pain syndrome, and these are all autonomic nervous system disorders that are mind-body. Next slide. And then there's all the other ones that I mentioned: insomnia, numbness, tingling, burning, chronic fatigue, dizziness, ringing in the ears. All these can be medical problems, but when a medical workup is negative, they are mind-body. Next. And so the pain clinic model is, well, you have tissue damage. We don't need to search for an underlying cause. We can't reverse it. We can't get rid of your pain, but we'll help you learn to cope with it. That's not what most people want. What people want is to get rid of their pain. And if it's a psycho-physiologic disorder, you can get rid of the pain once you understand it, once you take control of your life. You can change your brain to change the pain. Next slide. So these are the 4 components of the program that I run. The first component is education. It's understanding that you or that your client has a mind-body problem. It's being 100% certain of that. It's believing that. If people don't understand that and don't believe that, it is very hard for them to get better because they keep falling back into doubt and fear. And it's hard for them to have confidence that they can change this when they don't really believe it. A lot of what I do as a medical doctor is see people, examine them, look at their x-rays, look at their lab tests, and help them distinguish between what is a medical problem and what is a mind-body problem. And I can't emphasize this enough. Because when they really understand it, when they really believe it, it's like a light turns on in their head, and all of a sudden there's a tremendous power that can come with in order to heal, change the brain to change the symptoms. So the second part is behavioral interventions. I ask people to stop being afraid. I ask them to fight the fear, stop the fear, laugh at the fear. I ask people to stop the symptoms, tell the pain to go away. It sounds really silly, but it's amazingly effective when you really understand that this pain is something that you can make go away. And there's a whole variety of behavioral methods, from visualizing it going away, to yelling at it, to laughing at it, to being kind to yourself, and just allowing yourself to not pay attention to it, not feed it. Pain of a mind-body variety is fed by fear of the pain and fed by preoccupation with the pain. Doctors have been telling patients, well, chart your pain. Tell me, monitor how it is. Is it a 7 now or a 6? Is it a 5 or is it an 8? But that constant awareness of the pain, the constant monitoring of it, the constant preoccupation with it is part of what drives it to continue. We need to change that. And people need to challenge the triggers to their pain, such as activity or foods or weather or certain people. They need to change that so they can start walking and start moving and start bending and start sitting and start running once again. And even though it hurts, they have to do that. And that requires a tremendous amount of courage and bravery that I ask my patients to do. Frankly, most people don't want to do it. Most people do not want to do this. They'd rather have somebody fix them. But the patients we see can't be fixed by medical treatment. They have tried it, usually for years or decades. And then third is the emotional interventions. I use intensive short-term dynamic psychotherapy model, which we can talk about. It's a model that asks people, and it's in my book, Unlearn Your Pain. There's a description of it. And it asks people to express the emotions in their life and from the past instead of holding them in. So it asks people to write letters to say how angry they are about something, or to yell at the person, not in real life, but at the pretend person in the room. It's called the empty chair, is part of the psychological jargon about that. And to get the anger out, to express any guilt that might be there, to cry and let the sadness and the tears come, and to then move past all that. Once they've released the anger and the guilt and the sadness, then they can move to love for themselves and letting go of the situation from their life. And when they can do that, there's a tremendous relief of the emotional burden, and that allows their pain to just start going away. And then finally, the fourth one is life changes, acting in our lives, acting with assertiveness, acting with kindness, standing up for themselves, and changing whatever they need to change in their life, because the pain is telling them there's a danger in their life of some kind. Next slide. There's some research, lots of research on ISTDP. It's an emotional technique developed by Dr. Davenlew in Montreal. Dr. Abbas, Alan Abbas, is my teacher of it, and he's in Halifax, Nova Scotia, and he's done research in Canada showing the powerful efficacy of this treatment. Next slide. This is Jody. Jody is a woman who was abused as a child. She says, stand up for the little girl or neglect her. Stand up for that little girl. Change the pattern. Change the patterns of the abuse from fear to strength, from low self-esteem to confidence. And you can do that by using the emotional techniques, and I ask people to stand up to their lives, stand up to the offenders in their life, stand up to their pain. And so a lot of it is really creating the power within them to change their brain in order to stop the pain. And it is eminently doable. Next slide. So what do we need to understand? The symptoms are real. They're very real. They can be incredibly severe, even when there's no tissue damage. When there is no tissue damage, the learned nerve pathways are what's causing the problem. Emotions are what causes these learned nerve pathways. There's a reason for it. It can be treated effectively, and this is a human condition. Everyone has this to some degree or another. I certainly do. I've had it many times in the past, and I recognize that we all have mind-body symptoms. We are all created this way. Oftentimes I say to some of my patients, I know your problem. You're human. It's not your fault. the situations that have occurred in your life are real and have caused these nerve pathways. Next slide. So this is a simple yet revolutionary concept. Stress and unresolved emotions create real physical pain by triggering nerve pathways. The brain is extremely powerful. Emotions are at the cause of this, and if you look hard enough, you will find the reason for these symptoms. Next slide. And this is something that doctors need to know. This is something that needs to change in our society. If we don't understand this, we're going to continue down a biotechnological path of treating disorders that are not structural, medical, pathological disorders. We used to think the earth was flat, now we know it's round. But the people who said the earth was round when everyone else thought it was flat were banished. we're treated as pariahs. But over time, more and more people realize that there's something wrong, there's something amiss. That is the situation we are right now with chronic pain and these other syndromes. We are now beginning to have more and more people question the medical explanation for these. And a few people are speaking out. And pretty soon, more influential people will speak out, like Dr. Oz, like Oprah, like people who are cultural icons, like, what's his name, Sanjay Gupta. And pretty soon, the old belief will change, and people will say, oh, we knew it all along. And hopefully, in our lifetime, we will see this change in society, and more and fewer people will suffer needlessly with these severe mind-body problems. Next slide. This is a lady, it's the last slide, a woman who I saw who had a very difficult situation. Her son was a drug user. He was abusing her. He was stealing from her. And she wanted to try to help him and kept trying to help him, but he kept being abusive. And she had severe headaches, severe pain, severe fatigue. And she says, to have health in our bodies, our minds need to be at peace. I have learned things that I needed to learn and have made difficult yet important decisions about my life and my relationship. She had to change the relationship with her son. She couldn't continue to allow him to abuse her. And she said, as I have found peace, I like myself more, and I find that my body is healthy again. And that's why I'm better. And this is what I wish for the millions of sufferers of fibromyalgia, chronic fatigue, chronic pain, etc., that they also understand the truth about what's causing their symptoms and learn to find peace in their lives, and they will heal. So I think that's all the slides that I have. It's 10 after 8. We're right on time. We said we would leave about 20 minutes for questions, and I will be more than happy to entertain those if there are any.
Well, Dr. Schubiner, thank you so much for an outstanding, inspiring, informative presentation. I think the capacity of your work can really significantly change people's lives. And I know as a fellow clinician working with patients, your work has made a huge difference. And I really like what you said because, there are a lot of allopathic clinicians out there, healthcare providers, that really don't understand mind-body syndrome. So I know there are patients out there that get discouraged and they feel like there is a pathological basis, and they really don't see just how powerful the mind is through exercising kindness, compassion towards oneself, utilizing their own internal ability to feel empowered, and combating those fears, those traumas. Which leads me to a question, and then I think Heather Butts, our producer, has some questions too from our participants. But when one embarks on this program, Unlearn Your Pain, is it better to begin at a point of affirming oneself up, shoring oneself up first before one gets into that emotionally charged material such as fear and trauma, what would you recommend for the person who may be tentative, trepidatious, to really get into this program in a very healthy, healing way?
Right, that's a great question. Everybody comes at it in a slightly different way, I think, but I think what you're asking is, does one need to have a certain amount of resilience, a certain amount of self-esteem and self-worth and self-caring in order to do this, some of the hard emotional work? And I think the answer is yes. Sometimes people are so beaten down, so fragile, so anxious that they're not ready to do this work, and that is unfortunately common. And so frequently they need counseling, they need therapy, they may need medications to help with the anxiety or the depression or the pain to be able to start doing this work. The first step is really the education. Frequently, people, when they're told that they may have a mind-body problem, when they're introduced to the concept that the mind can cause severe pain, oftentimes they're violently opposed to that. It creates a violent emotional reaction in them, and some people think that that's because they really know at a deeper level that it is the truth. But excuse me. People in that situation are clearly not ready to start doing this work. And people who are very fragile are not ready to start doing this work. So the first thing really has to be education and shoring up their resilience in order to then begin the sometimes difficult task. Sometimes just understanding that it's a mind-body problem can free them from pain, literally. Not everyone has to do the deeper emotional work.
Well, thank you so much for that. That answer more than answered my question. And I would suggest that anyone who has a question, you're welcome to type that into the chat area, not the Ask a Question icon, but the chat area. And I believe Heather already has a few questions. So, Heather, I turn it over to you.
Yes, so this was such an amazing presentation. I want to thank you so much, Doctor, for doing this. So several slides were very intriguing to individuals. One question has to do with chronic pain associated with interacting with family members who may have contributed to an abusive household. So we have one query regarding how to deal with the pain that seems to trigger physical pain when you have to be faced with family members that were abusive, and there's been no real sort of like a resolution to that situation.
Right. Yeah, that's unfortunately common. Our family members are the ones who affect us the most in our childhood and in our lives, and the key is one is understanding, and as this person obviously does, that the family members are the source of the pain. So it's understanding that. So the education is there. You know what's causing the pain. Second step is doing the emotional work of dealing with the underlying emotions that occurred from the childhood situation. And I use, as I mentioned, I use the ISTDP technique. There's something called somatic experiencing, which is another technique which is very useful. But once, and so hopefully both of those things can occur. But once someone has done that, then they have to make decisions in their life about how to relate to these family members. If the family members are toxic, it might be a good idea to avoid them, to stand up and say, "You are toxic to me," whether you say it or not. Decide that they're toxic and they are not going to be part of your life for one day or 1 month or 1 year or whatever it is. So there's a certain amount of protection that people need to do for themselves. If they keep going into a situation where they're being abused, they are going to, and they don't have a way of dealing with that, it's going to continue to cause pain, and that's not going to change. They need to find ways, and part of what we do in this program is to help people figure out what are the ways they can be assertive and protect themselves while being kind to themselves and trying to be kind to the other person, but not being, not being submissive or not continuing to put themselves in a situation where they continue to just take abuse. That is not a recipe for, obviously, that is not a recipe for health. And sometimes there's a certain amount of balance that needs to be shifted a bit. Sometimes it's not as severe as saying, I'll never, I'm not going to, Mom, I'm just not going to see you, forget it. But I'll see you X amount of time. And when I come over, it's going to be for this. And we're not going to talk about that. And certain things are not allowed. And the ability to stand up and be kind to oneself by being assertive has to be part of this equation.
Thank you so much. Ed, we have another question.
Okay.
Yes,
we have enough time, so please feel free to ask away, Heather.
Okay. So I was not aware of this, but apparently back pain is the leading cause of the reason that people actually miss work. And so we have a question about sort of the cyclical nature of work causing back pain, and then back pain being the reason that people miss work. And maybe you could speak a little bit to the cyclicalness of the back pain, missed work, back pain, sort of like triumvirate there.
I'm not clear. I have the question formed.
The question is, it seems that back pain is a reason why people miss work, but according to the Norwegian study that you were talking about, it also actually, people actually suffer from back pain because of work.
Right,
so it seems like there's sort of this unfortunate link between missing work because you have back pain and getting back pain because work is causing back pain.
Right. I mean, the mind is telling you in this situation work is toxic, just like the situation with the family member. The body's telling you work is toxic to you in some way, and probably it's a way it's because of colleagues or bosses or stress on the job or whatever it is, or a combination thereof. And so the mind is creating the pain in order to stop you from going to work, and it's often successful. But it's not a good way of solving the problem by having pain. And so people need, first, obviously, they need to understand that the cause of the pain is the work situation. Once they understand that, then they have to make decisions. Okay, is this a job I need to leave? Is this a job I can change? Is this a job something can be different in? Or am I going to stick with this job for X amount of time and look for a different one? Or is there something I can do in my job to make it better? Do I need to stand up to somebody at the job situation? Do I need to stop putting so much pressure on myself? Because oftentimes the problem is it's not only the situation at work, but it's the self-imposed pressure that people are creating, and they need to change their relationship with themselves. So, yeah, that's a common situation.
Wonderful. One more question, this is actually a question that I have, is regarding individuals who seek out, who want to have a collaborative relationship with their physicians, and essentially like the T-shirt that we saw, which talks about I decide to put myself in charge. How do you advise individuals to speak with their doctors about these pain triggers, and in a way where they're not either being heavily medicated or, they're not getting prepped for surgery? How do you advise individuals to have that honest conversation with their physicians?
Most physicians are open to patients taking more responsibility. Most physicians are very open to patients decreasing the amount of medication they're taking. Most of my patients decide they're going to need less medication and want less medication, and they start weaning themselves off of their medication. And most physicians are very happy with that. But I've had lots of patients go to their primary care or their specialty doctors with my book or with this program, and they tell them, doctor, I think I think stress is a big part of my problem. And the doctors sometimes go, yeah, well, that's great. I'm really glad, that this is helping you. And other doctors saying, oh, no, stress can't cause this. You don't understand. And so there's still a lot of as I said, lack of understanding among physicians in this country in terms of the relationship between stress. They don't understand that the mind is powerful enough to produce virtually any symptom. And so, it's a problem. I speak to doctors all the time. I lecture to physicians all the time, and usually they shake their head, yes, oh yeah, this makes perfect sense. But rarely do they talk about this with patients. Rarely do they refer patients to me with these kind of problems, because they just kind of go on their merry way. It's a cultural shift. It's a shift in how we view pain as being either structural damage or nerve pathway, as opposed to only structural damage. And when that change occurs, we're going to be a lot better off as a society.
Thank you so much. I know, Ed, we probably have to transition back to you, so I can send you the rest of the questions and we can answer them offline.
And that is a good point, Heather, that anyone who has a question is more than welcome. If you're joining us now, you can see Dr. Schubiner's email address. That's hschubiner@gmail.com. Also, Dr. Schubiner's website is www.unlearnyourpain.com, an outstanding website. You're also welcome to email info@mindbodymedicinenetwork.com, and we'll share any question you have with Dr. Schubiner. Dr. Schubiner, I had maybe one more question to ask you, and as you know, I have led Unlearn Your Pain groups, and then the people enjoyed it so much, they wanted to continue in a support group, which was so affirming to each participant and supporting one another and creating a wonderful support network. So my question is, for those people that have taken part in your Unlearn Your Pain program, are there one or two practices that you recommend over the long term to keep people happy, focused on healing, and really knowing that the power of their mind can deeply shape their health states?
Yeah, that's a great question. I think that the things that over time, as people recover or people have recovered and they want to continue to make sure that they stay healthy from a mental and psychological point of view, meditation, mindfulness type work is extremely useful as an ongoing practice. And the second thing I would say would be writing about their lives. And I do both of those on an ongoing basis, just using some of the writing exercises that we've put together are really helpful in clarifying situations and understanding situations and releasing and expressing emotions. Those would be the two.
Excellent. And already, my Unlearn Your Pain support group meets tomorrow night, and we do a lot of sharing, affirming, but we really haven't done a lot of writing together. So I'm going to encourage that people do more of that, and we can do it together in the group, because participants have shared with me how helpful that writing is. So in closing, Dr. Schubiner, you have a website. Can you share maybe a couple of ways that people can take advantage of your services, your programs, if folks want to follow up after this webinar with you?
Sure, that's nice. The website that I have has a lot of information on it that I think should be useful. There's a lot of links to other resources, like the tmswiki.org, which is a peer network organization for psycho-physiologic disorders. tmswiki.org is a great peer support organization online. The program that I run is online. There's You can order it online, but it's also in my book. My book is cheaper. It's called Unlearn Your Pain, and the program is in the book. All the writing exercises, the meditations, the whole explanation, the emotional work, the ISTDP work is all in the book, and that's the place I generally recommend people to get started if they want to really start on doing this work in their lives.
Outstanding. And folks, for any of you that are listening to the live webinar, you will be getting an audio and video recording within the day. It's yours free of charge with you participating in the webinar. For anyone else that you would like to recommend the program to, please send them to www.mindbodymedicinenetwork.com, and an archive recording is available for purchase. So, Dr. Schubiner, thank you for an outstanding program. And Heather Butts, thank you for producing our webinar this evening. And I want to thank all of our participants, whether you're here live or you listen to us in the future. We're here for you. Dr. Schubiner is so approachable. I have had my own clients and patients contact him, and he's been so gracious with them. And then you're also welcome to contact me, Ed Glauser, the owner and principal clinician with the Mind Body Medicine Network, and we'll get you whatever assistance you need. So any last words, Dr. Schubiner, before we wrap up?
No, I really appreciate the opportunity to do this, Ed, and I think the more people who know about this, the better we're going to be. So if anyone's out there who's having difficulty or struggling, the important thing is to go back to the truth of nerve pathways that can be reversed. And famous person once said, "The truth will set you free." When people live in alignment with their truth and who they are, their pain will go away.
Beautiful. Wonderful last words. Everyone have a wonderful evening, and thank you for joining us.